You stretch, you strengthen, you follow all the advice that you can find on the internet. But what if the problem was that you're skipping step 1? I will take you through the framework that I use with all of my clients, which covers the essentials of human movement at the pelvis and the hips. Stand with your feet under your hips. Use your hands to find your pelvis and imagine that you're holding a bucket of water. See what it's like now to tilt that bucket so the water pours out to the front, and then tilt it the other way so it pours out to the back. What do these movements feel like? Can you do them easily, or is one difficult, maybe even painful? And how much range do you have in each one of them? These are two essential movements of our pelvis, and later I will explain exactly why they're so important if you're struggling with anything from back pain to limited hip mobility. And we will also cover how you can work on them. But first of all, let's finish off the rest of our pelvic movements. Next, keep both of your feet on the floor and bend one knee, making sure that you keep the other one straight. What you're going to notice is that the side of your pelvis with the knee bend will drop, so you end up with a hiked and a dropped side of your pelvis. Do this on the other side, and you have just covered 2 more of those important movements of our pelvis that should, in theory, happen in every footstep that we take. Here again, do you find that both are kind of awkward or difficult to do, or is one of them easy whereas the other one feels hard going, or maybe there's even discomfort somewhere? And of course, as before, how much range do you have in each direction? We're still checking in with our frontal plane, but this time we're going to shift our pelvis side to side. Same as before, is one easy and is one more difficult? Maybe it's uncomfortable, maybe there's pain somewhere. And how far over to the side do you go, to the left and to the right? And lastly, we will check pelvic rotation. I suggest that you place your hands on your chest in order to keep the upper body still. And now turn your belt buckle to the left and to the right. And maybe you already find this difficult. Many people struggle to rotate their pelvis without also rotating the upper body. If that is you, we also count that as a restriction. Maybe you found that your upper body wants to join in more on one side than the other. Maybe you found that you can turn your pelvis one way kind of okay, but the other one there's almost no range. And of course, maybe there's discomfort somewhere in either one of these rotations. Next, let's talk about why these are all important motions for your back and your hips. Before then, exploring them again, but in a slightly different way. I do hope that you made some notes about what you struggle with. And if you haven't, I suggest that you go back to the beginning, redo those movements, take some notes so that later on you can compare your before and your after. We looked at the anterior and the posterior tilt of our pelvis. This is often a game changer for people with lower back issues, because as you can probably feel, when we go into an anterior tilt, the water pours out to the front, we get an extension in our lumbar spine. With a posterior tilt, it's the opposite. The water pours out the back and our lumbar spine now flexes. If you're doing this cleanly, the muscles around your lumbar spine get the chance to lengthen and to shorten. Your spine gets a chance to flex and extend. For the hip, this is a nice opportunity to move through flexion and extension. So your hip flexors will really like it if this motion gets unlocked. So let's see how you do these. When you tilt your bucket forward so that the water pours out to the front in your anterior tilt, ask yourself whether you're actually dropping the front of your bucket, or whether instead you're pulling the back of your bucket in your pelvis back and up. So let's explore these in these two different ways. When we pull the back of your pelvis back and up, you can feel how much work there's actually going on in the lower back, and you can also see how the pelvis kind of starts to shift back behind the upper body. So place your focus on the front and imagine you have a belt buckle here. And you want that belt buckle to drop down onto your toes, basically. You can also think that with your belt buckle, all of your organs here in your lower abdominals, they start to drop down to the floor in front of you as well. So hopefully you can see how and feel how this is a much smoother motion, that really starts to take a lot of compression and work away from the lower back. So you can practice this a little bit. And then we can do the same with our posterior tilt, where we pour the water out the back of our bucket. So when you go into this posterior tilt, are you crunching your abs or are you contracting your glutes? And see what it feels like if instead you focus on your back pockets and you think about dropping or sliding down those back pockets towards your heels. So just as before, think about the side that actually drops, not the side that is pulling up. Make the movement small initially. And also check that you're not moving into this posterior tilt by bending your knees. If you're bending your knees, you're moving your knee joint and not actually your hip joint. So that's where you probably really have to reduce the range of motion that you're looking for and just have this clear intention of dropping your back pockets down. So let's slowly move forwards and back between those two. We have our belt buckle in the front, dropping towards our toes. And from there, we shift our focus to our back pockets and slide those back pockets down towards our heels. Belt buckle through the toes, organs drop, back pockets down to the heels, and the knees stay straight. Move as slowly as you can and always think about the side that is dropping. That's where your focus is. What you might also notice here is a slight weight shift. So as we're dropping the belt buckle towards our toes, see if you can allow your body weight to shift towards the front of your feet. And likewise, when we drop the back pockets down to our heels, allow your weight to shift back into your heels. So explore this in this coordinated way. And maybe you find that this is actually what's the challenge. Maybe you struggle to either put your weight into the front of your feet or into your back. But hopefully, as you're starting to coordinate the intention of your movement with the weight shift, you can feel how the movement clears up and feels a lot nicer. So practice this and move much slower than you think. And move with a clear focus on the dropping side and try not to push for more range. More is not necessarily better. Better is better. Next, let's look at our hikes and drops of the pelvis. First of all, imagine that the axis of rotation for these hikes and drops is in the center of your pelvis or the pubic bone. Now ask yourself, are you moving your pelvis around that axis so that one side comes down while the other one comes up, basically like a seesaw? Or are you shifting that axis sideways around in space? Are you possibly even turning that axis towards one side? Very often when the pelvis is not moving freely, people start to shift their weight into their bending legs. So they shift the axis so it kind of looks like this. This is important because if we can cleanly move around this axis and move the pelvis basically like a seesaw, we get some lovely movement through the lumbar spine as our upper body above naturally accommodates that movement by creating a gentle curve in the lower back. Your hip joints will either adduct or abduct which means the glutes and the adductors both get the chance to lengthen and to shorten. So if you have problems with this movement on one side, see what it feels like if you think about that axis of rotation in the pubic bone and visualize a seesaw motion around the pelvis. Pay attention that there is no huge weight shift, and if anything, allow your weight to drop a little bit more into your straight leg. Here again, move really slow, keep your intention clear, because many people simply rush this movement and kind of dump it all, kind of like this, just side to side, but you have to move slow in order to clean it up. Also try to keep your upper body centered on top of this pelvis, so that it's not now your upper body that starts to put your weight into your bending leg. But if this is the case, this is where you could ask yourself, why might it fall away from the other side? Often this can lead us to old and importantly non-symptomatic injuries from the past that our body has simply learned to stay away from. But you can see the implications of these old injuries onto our present movement. We then looked at our shifts. Especially if you experienced some kind of lower back discomfort in your shifts here, ask yourself whether you're actually shifting your pelvis or if you're only bending your spine and the pelvis kind of stops. This could, or very often, gives people kind of an excessive lengthening and load that's quite uncomfortable around the QL. So place your focus on your pelvis to let the pelvis truly shift over to the side, and you can feel how this pulling, possibly that discomfort above your waist, actually starts to go away because you're now starting to place the focus, the load on the outer hip tissue instead. What you can do to place the focus on the hips if you found they're not really shifting one way, so you can take a chair, put it next to you, and use that as a little target so that you can kind of bump into that chair to place the focus on your hip. As that starts to get easy, of course, you can start to increase the distance. And then as you're going further and further, you will probably start to feel how now this outer hip actually starts to experience that length. And we can take the pressure away from the lower back and the QL. So here again, this could potentially lead you to an old problem in the leg, foot, or ankle, as your body has potentially stopped really moving into that side. Maybe this even matches what you found in the hikes and drops before. By restoring your ability to do this to the left and to the right, you're again creating some nice lumbar motion as well as tissue load for both the adductors and the lateral hip tissues. And lastly, we have our rotations. Maybe you felt blocked one way or had some kind of discomfort there. And what I would like you to pay attention to again is a weight shift as you turn left and right. Which foot takes your weight when you turn left and right? And again, does that match, or is there an overlap between your hikes, drops, and your shifts? And is it a rotation? Or is it actually an entire shift of your body? Pelvic rotations are what give our hip joints their internal and external rotations, which in turn affects the outer hip tissues such as the glutes, as well as everything on the inside around the groin. And even our hamstrings and our adductors are affected by these rotations. Now try to do it in this way. Try to stay tall throughout your spine. So imagine that you're inside a tube, or that you're basically turning like a doner kebab without shifting around. So as we're turning to our right, see if you can allow your right knee, the knee that you're turning towards, allow that to straighten, while you also allow your foot pressure to move to the outer back heel on that right foot. So we turn towards the right, allow the right knee to straighten, and we let the pressure in this foot move to the outer back corner of our heel. Let's turn left, now allowing the left knee to straighten and the pressure in the left foot to move back and out. And maybe you find that it doesn't quite do that in the leg or the foot on that side that you found is it more difficult to turn towards. So work on this pattern, turn like a kebab without shifting it, and allow the weight to shift to the outer back heel whilst simultaneously allowing the knee to straighten out. There are lots of details that we could look into around the feet here. And in addition to the foot pressure, see if you can maintain contact in the ball of the big toe whilst doing everything we just talked about. A wedge can be really useful here. And if you find it's more challenging on one side, again, this might lead you to an old problem that might explain why that rotation in this direction is a struggle for you. Rotations are what bring our hips to life, which is why you see so many exercises online focusing on hip rotation. But as you can see, if the leg and foot below don't play along, none of that work will ever come to life. So there you have it. I would suggest that you try this a few times, and as I said a few times, move slowly. When we rush these movements, that's often because it's our way of staying away from or overcoming a problem area. Listen to the cues, and I'm sure that this will change how the movements feel, and in many cases, discomforts already start to ease. Once you've done this a few times, go for a little walk, and you'll probably already feel a difference in your gait. Also make sure to go back to the beginning of all of your movements, see what has changed and what has remained the same, which is then worth a further investigation. What I'm hoping this will do for you is this. I took you through the motions in the pelvis that we should all have access to when we go for a walk, which is arguably the most fundamental of human movement that we also all have in common, no matter what we do in our life. I'm sure that some movements that I took you through were easier than others, so that immediately actually gives you something to work on, which begins to create clarity and a starting point. If you can do a movement on one side, for example, but not the other, you can begin to understand why there's discomfort somewhere if you only move into that one side, for example, or if your spine, therefore, only ever bends one way. Keep practicing and restore what's missing through these motions. But this can potentially be the beginning of further investigations until you find the true reason behind these limitations. Many people find that there's an overlap between these movements. For example, in the hikes and drops, that weight falls into the leg that is bending, and that is the same leg that they're struggling to shift their pelvis into or to rotate into. If you begin to notice these things, ask yourself why that might be. Your injury history plays a really crucial part here, as you might have sprained an ankle and you completely forgot about it. So there you have it. Pelvic and hip mobility really isn't that complicated in the context of gait. I hope that you found something interesting and some insights about your body. If you did and you have some questions, feel free to comment or to message me directly. If you liked this video and you would like to learn more about my work, anatomy in motion, your body, biomechanics and pain, hit subscribe and visit my website or my other social media channels. Thanks for watching. I'll see you next time.